looks like Kaiser had an incident recently whereby they'd installed some analytics software that siphoned off not only some kind of generically identifiable data, but also things like specific search terms that patients had used within one of their portals, and sent it to a number of platforms that are definitely not equipped or committed to handling this data in a HIPAA compliant way. What else have you seen about this?
What's interesting, this is technically the largest health-related breach so far this year. It's not passwords and social security numbers and that kind of thing that were directly stolen, but equally, the problem that all this stuff collected by analytics tools and like indirect information about users, like what medical terms or concerns they have, is what's actually compromised, and it's still a really big deal.
Well, and in a lot of cases, I mean, I would consider this more serious. Like, I can
Totally
reset my passwords. I do all the time. My password is a random string. I mean, honestly, even my social security number, I actually take good care of it, but that's probably been in a data breach somewhere. It's much more intimate to me, what medications I'm on or what health conditions I may have. That's something that is kind of unchangeable and more personal than a lot of this other information. I see very much why people are upset about it. I think it's also interesting. I'm curious your take, but this is the kind of thing, it's legally a data breach, but they weren't compromised by a third party. That line is very fuzzy, especially in healthcare. Is security responsible for this, or is this another part of the organization that should be? They didn't have a data breach. They didn't have an external data breach.
Totally. You're exactly right. This isn't like a cyber attack. It's a data leak. I think this is definitely something that falls under compliance, not security, not IT security. Somewhere there was a disconnect here. I was going to ask you who you think is responsible also, but like this is one of those things that this should have come up in proper vendor diligence. During the vendor diligence process, you're not just looking at, does this company have an ISO 27001? You're also looking at like, what information does this product have access to? How is it transmitted? What is the flow of data? What does their network look like? How much data do we actually have to send to them? And so that was one part of this that we don't know what went on in the company. Like that part of it would have fell under the IT security and vendor diligence, supply chain diligence, process under security. But it's really compliance's job or legal's job to understand, do we want to be collecting that information? And one of the problems that happens in organizations is that when you're so focused on one thing, it's like that. Have you seen that video where like the psychology study where they tell you to like watch how many basketballs are being, whatever, and then So it's the same thing here. It's like when you're so focused on private health information and HIPAA compliance, you forget that like, oh wait, like, analytics data of like whatever can also contain health information and whatnot, and just private data.
Well, I mean, I'm just taking a guess here of what probably happened, right? Probably, some web development team decided to implement analytics software and went ahead and did it. And there are two places where I'm
that impacted 13.4 million people. Some web development
because they maintain this platform. And I'm guessing two things went wrong. One, this is an organization that's clearly subject to HIPAA.
Yeah.
Are those training obligations across the organization being taken seriously by the company, by the employees? If you're a web developer, HIPAA applies to you as much as it does to the database team, as much as it does to anyone else at the company, because you are building products that access that data. So that's the first question I'd ask, is that training being taken seriously and working? The second question I would ask, under all the compliance frameworks, there are a lot of obligations around secure code review and multiple approvals before anything is merged. Let's say I, as a developer, implement analytics in a way that shouldn't be acceptable. Who then is reviewing that? And is that review process by another developer being taken seriously? Because someone should have caught this before it got merged to production and deployed live to a site with 13 million individuals using it.
So it's a great point. There's something interesting here. Usually this kind of stuff gets implemented primarily on the front end. And so it's possible that maybe not in this case, maybe in this case, but generally speaking, like these sorts of issues will arise out of like front end development and like tagging different things that are inputted by the end user. Like, not to throw the front end developers under the bus, but like they probably have a little bit less exposure to the security training and secure lifecycle development that the back end developers have. So that could be an issue here too. I have a question for you. If you're on the board level of a company of this scale, what kinds of things do you think have to happen so that you watch out for, like, call this like blind spot risks, or like these are not the primary threat surface of your company. Like it's not the crown jewels, but like how do you support from a business perspective at the highest levels of a company to make sure this stuff is taken seriously?
I think this is one of those areas where like what gets measured gets improved, to kind of go back to the basic one. So, the comment you made about it being the front end, this might have honestly even been like someone in marketing or someone in sales. Like a lot of the times infrastructure is set up so analytics can be modified with no code by not the programming team. You may just, set up something like a segment, and then I can swap in that analytics as I want to someone on another team. It needs to be metriced across the company, like how we vet controls. I was talking recently, I was doing a security training, and one of my clients was describing how their finance team gets very impatient when you ask them if a real email is a real email and whether you should be wiring money. And, if the finance team is impatient about that, then people are going to stop asking, which means when one day it's not real, there's going to be a problem. So to answer your question, at the board level, the way you have to think about this is how do you validate all the false positive checks as being people doing their jobs. What I would want to check is not, did we catch the one-time analytics got implemented that were bad? What I'd want to check is, did we properly approve the 500 changes to our analytics where there was actually absolutely no problem? Like, maybe it took an extra day. I mean, security is inconvenient, unfortunately. But did we do it right in all of those cases? That's the way you actually fix this. It's like the old convenience store analogy, right? I can make an infinitely secure convenience store if it's just bricks all the way around, and I can make an infinitely easy one if I have no doors. But somewhere in the middle, there's probably a door. We probably lock it at night, and you kind of have to pay before you leave. Yeah, it's inconvenient that every time I go in, I have to pay for something, and maybe I, with the honor system, would pay anyway. And this analogy is dragging out, but I always try to use this example, like the process that works every time is the thing you measure, not what went wrong in the one case. So if I were, another company here, what I'd look at is how are we validating this in every case where it's fine every day? And how do we remind the marketing team that, no, you're not wasting someone's time if you require that we validate what settings are active when we deploy a new plugin, right?
Yeah.
And a long answer, but I guess I'll pause so you can cut this into a separate point. But I think we often forget, as part of security and compliance reviews, that there's really two pieces. There's vetting the company, and let's be honest, like Google is going to pass basically any security review. So vetting the company, great, we did that. We have their SOC 2, we have all their certifications. But then separately, there's vetting how we're going to use the product, right? I mean, Google can pass all my security reviews,
right,
but I still can't and shouldn't use GChat to manage HIPAA compliant information. That's a user problem. That's not Google's problem. So we need to remember when we're assisting clients with security reviews to vet the company, but then we also need to vet the specific use case of the software within the company. Those are not the same thing.
And I think it's the claim of HIPAA compliance is such a loaded concept. Mm-hmm. And I think most companies do this incorrectly. It's the new bank grade encryption kind of term that I hear, which is I actually give credit to AWS because I think they do it correctly. I was recently at a developer talk at AWS, and they referred to it as HIPAA compatible. And I think that is really key here. Using these services that call themselves HIPAA compliant does not make you HIPAA compliant. At all. It can be HIPAA compatible. You could use it, and it's possible to use this in a HIPAA compliant manner. And so, I think that's one of those things that people fall into traps where they're just oh, the thing I'm using is HIPAA compliant, so it's fine. Mm-hmm. But the last thing I want to say on this is that this is another one of those situations where this is how it actually happens. There's no big smoking gun. What failed here is something was done and never reviewed properly. People didn't check it the next time around. And people didn't think of a second set of eyes didn't go like, wait a minute, are we sure that this isn't happening? And so you have to take that as an important, step if you're coming in at the board level or the executive level. Like, how often are you actually reviewing these kinds of things?
And people don't care, which is crazy. It comes back to the point we made earlier about, you never think it'll happen to you, and you assume if a client isn't making you do it, it's not going to be a problem, until it is. And yeah, anyway, not necessarily interesting for sharing, but just kind of crazy that genuinely people don't care.